Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Anaphylaxis. Introduction. Anaphylaxis is a severe allergic reaction. It happens when a person comes into contact with an allergen. Examples of allergens include certain foods, medicines, insect stings, or other substances. Anaphylaxis requires immediate medical attention. During anaphylaxis, your blood pressure drops rapidly. Your airways can narrow, and it may be hard to breathe. If left untreated, anaphylaxis can cause death. This program explains anaphylaxis. It talks about the symptoms and causes of the reaction. It also discusses how anaphylaxis can be treated and prevented. Allergies. The immune system fights viruses and bacteria that can harm the body. Some substances that enter the body are harmless. The body usually ignores them. Allergens are substances that are usually harmless, but in some people, the immune system thinks allergens are dangerous. When the immune system thinks allergens are dangerous, it triggers an allergic reaction. An allergic reaction that is severe is called anaphylaxis. During an allergic reaction, your body thinks an allergen can cause you harm. Cells from the immune system release substances to fight the allergen. One of these substances is called histamine. Histamine causes small blood vessels in the body to widen and leak. It can cause tissues to swell. Histamine can also cause the body to contract muscles in the airways, increase the heart rate, make gastric acid. The release of histamine and other chemicals in the body also causes other symptoms of an allergic reaction. These may include asthma, itchiness, runny nose, sneezing, swelling. Anaphylaxis. Anaphylaxis is a severe allergic reaction that affects your whole body. It can cause death. A person who is exposed to an allergen over and over again may have a more severe reaction with each exposure. This can eventually lead to anaphylaxis. The reason that some people have allergies is not clear. Allergies may be passed from parents to their children. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of anaphylaxis usually happen within minutes of exposure to an allergen. In rare cases, the symptoms can start up to an hour after exposure. Symptoms of anaphylaxis include dizziness, feeling warm or hot, nausea, vomiting, or diarrhea, trouble swallowing, weak and shallow breathing. Anaphylaxis can cause skin reactions including hives and itchiness. Your skin may look flushed or pale. Anaphylaxis also can cause the face, eyes, and tongue to swell. Anaphylaxis may make it hard for you to communicate. You may feel confused, anxious, or unable to form full sentences. You may become unconscious. During anaphylaxis, your blood pressure may drop. This could cause an irregular heartbeat. In some cases, it can cause the lungs to stop working properly. It also can cause the heart to stop. Anaphylaxis may cause death. Anaphylaxis is a medical emergency. Contact a healthcare provider right away if you or someone you know has symptoms of anaphylaxis. Causes. Anaphylaxis happens when your body comes into contact with a certain allergen that your body thinks is harmful. Some examples of allergens that can cause anaphylaxis include certain foods, dust mites, mold, and pollen, insect stings, including those from bees and hornets. Other allergens that can cause anaphylaxis include latex, certain medications, pet dander, Common foods that can trigger anaphylaxis include nuts, shellfish, and milk products. If you are allergic to these foods, eating, touching, or smelling them may cause anaphylaxis. Certain medications may cause anaphylaxis in some people. Some people are allergic to aspirin, ibuprofen, penicillin, an antibiotic that is used to treat infections. Rarely, drugs used for anesthesia may cause anaphylaxis. Treatment. Seek treatment right away if you or someone you know has symptoms of anaphylaxis. Call 911 or emergency medical services right away. Have the person lie down and try to calm him or her until help arrives. CPR may help deliver oxygen to someone who cannot breathe. CPR stands for cardiopulmonary resuscitation. It is an emergency procedure for a person who is no longer breathing or whose heart has stopped. Epinephrine is a hormone that can relax muscles in the airways and tighten blood vessels. This can slow or stop the effects of an allergic reaction. If you know you have a severe allergy, you may carry a device with you that can inject epinephrine in case of emergencies. This device is called an epinephrine auto-injector, or EpiPen. You may be given oxygen at a healthcare facility to help you breathe. An oral medication may be given to help open and relax your airways. Your healthcare provider may give you antihistamines or steroids to slow the allergic reaction. These drugs can reduce the inflammation of your air passages and make it easier to breathe. Prevention. If you know you have an allergy, wear a medical alert bracelet or necklace that states your allergy. These can be found in most pharmacies. Carry an emergency kit if you have an allergy. This kit may include an EpiPen. Talk to your healthcare provider about what you should carry to help treat anaphylaxis during emergencies. If you have a food allergy, be careful to avoid products that contain the allergen. Read the labels of all the foods you eat. Make sure the foods you eat did not come into contact with the allergen. If you are allergic to certain insect stings, avoid insects. Wear long-sleeved shirts and pants and avoid tall grass. Do not make sudden movements if you are near insects that can sting you. Tell your healthcare provider about any known allergies to medications. In case you have a severe allergic reaction, wait at least 30 minutes in a healthcare facility after you have a shot. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Anaphylaxis is a severe allergic reaction. It happens when a person comes into contact with an allergen. Allergens are substances that are usually harmless, but in some people, the immune system thinks allergens are foreign or dangerous. Examples of common allergens include dust mites, mold, and pollen, certain foods and medications, insect stings, latex, pet dander. Symptoms of anaphylaxis usually happen within minutes of exposure to an allergen. In rare cases, the symptoms can start up to an hour after exposure. Symptoms of anaphylaxis include dizziness, feeling warm or hot, nausea, vomiting, or diarrhea, trouble swallowing, weak and shallow breathing. Carry an emergency kit if you have an allergy. This kit may include an epinephrine auto-injector. Talk to your healthcare provider about what you should carry to help treat anaphylaxis during emergencies. Anaphylaxis is a medical emergency. If you or someone you know has symptoms of anaphylaxis, call 911 or contact a healthcare provider right away. Thank you for using Explain.